Caden started developing a very real, very significant anxiety towards needles when he was a young kiddo. His body just went into flight or fight. It was completely traumatic to him.
I would be terrified. The night before, I would have no sleep. The day, I'd be anxious the whole time. And when it came to the appointment, as soon as I got into the room, I would just get an extremely intense adrenaline rush, and I would do everything in my power to not get that shot.
We knew that he had school-age vaccinations coming up. I knew that it would be a bit of an issue, so I called ahead and talked to the school-based public health nurse. And we put in a plan in place. We were going to go there together. He would go early. We were going to give him some numbing cream on his arm, and we had a great plan. That anxiety just kicked in, and he just went completely rigid, was not able to relax at all. We tried shifting things. We tried different nurses. Nothing worked. We went into a private room where it was quiet, and at this point, his whole body was not going to have any part of it. So we decided to call it a day. We started talking to our healthcare providers. They suggested doing a needle coping class at the Alberta Children's Hospital. And he left that class feeling, I can do this. I have the tools in my toolbox. I'm fine with this. We were then invited to have a nurse practitioner come into our home. He ran out into the backyard. We got him to come in. An hour later, we were able to give him his vaccination. It should have felt good to him, but it still didn't. It was a terrifying moment. And then COVID happened. He wanted to get that vaccination to feel protected and feel safe himself. He had said that to us, but he wasn't sure how he was going to make that happen. And we weren't either.
The Low Stimulus Clinic is a clinic that we work toward helping clients get their vaccine in a safe way. The COVID-19 pandemic really pushed the need to have this clinic. We found there was a large proportion of our population that was needle phobic or neurodiverse of some sort that needed a location where they could safely get vaccinated.
I think the biggest thing that the Low Stim Clinic does, which is so helpful for our clients, is the pre-planning and the care planning around. How's this appointment gonna go? What do they need for comfort? Do they need to have their dog there or their hamster? And so really truly support clients with what they need.
You want to respect the process that they want to go through. Whether it is a breathing process, listening to music, they know that we are looking out for them, we're caring for them, and we want to devise a one-to-one care plan and an experience that is unique to them.
We generally spend about 15 minutes letting the client decide if this, is working for them. They'll take steps forward if they decide that they would like to sit in a chair, lie on the stretcher, lie on the floor. We also would, accommodate them in the waiting room. We do offer drive-through vaccines where we will meet the client at their car outside the front door or the side door of the building. And we also go off-site and vaccinate clients. We'll meet them where they feel safe.
I think that we take for granted the idea around therapeutic environments and how much environment can play on how smooth patient interactions go.
The moment you walked in there, just the feel was calm and quiet and welcoming, and it was unlike any clinic experience we had had before.
It wasn't as cold and clinical as all the other places. It felt warmer and friendlier almost.
They were very good at what they would do. They asked the care provider or the parent to come up and do all the necessary paperwork and all the logistics beforehand. And then when they were ready for Caden, they asked Caden to come in, and he was able to take one or two or however many people he wanted. So both my husband and I went in with him. And he sat in a chair by himself, and we just kind of stood to the side. And the nurse spoke with him for a little bit, and he said, "Can I see the needle?" And she said, "Yes." He said, Can we hold it on my skin for a minute so I can get used to it?" No problem, gave him the time. And then he's like, "Okay, I'm ready." Sitting by himself. And he got the vaccination, and it was literally 5 seconds. And I say to people, I'm not a crier, but I just broke down and I cried because I was shocked, it was surreal, but it was this amazing moment where I'm like, did that actually just happen? So when Caden walked out of there, we knew he had crushed this giant barrier that had been in front of him for so long. So I took his picture under the tree and we called every grandmother and every auntie and uncle and just said, guess what just happened? And we celebrated with milkshakes, and it was just this monumental moment for Caden and for our entire family. It was something that we wanted to celebrate in a really big way. It was one moment in a clinic, but the confidence that he got from that moment will forever change how he views injections, blood tests, vaccinations, IVs. All of that for the rest of his life is now changed because of that one moment in the low stim clinic.
I feel much more comfortable now that I know I'll have the extremely helpful environment of the low stimulus clinic, and I feel like if maybe in 2 more appointments like that, I might actually be over my fear of needles.